Last time on Advancements in Healthcare, we followed Paul throughout the day during his outpatient shoulder replacement. Today, we'll check in on Paul's recovery and rehabilitation.
Good news. Take care. Best of luck to you.
Everything's actually going pretty well. Not too much discomfort. More of the discomfort really is in my arm a little bit in the bicep, a little bit in the forearm.
Paul wastes little time getting back to his normal routine, but he'll need to implement a lot of changes to ensure his shoulder heals properly.
For the first few weeks after surgery, the key area that we need to protect is the rotator cuff tendon. Paul needs to be responsible for that.
I would say the biggest challenge, comically enough, is trying to take things a little bit slower, a little bit easier. You're not really allowed to move other than just your hand or your wrist or from the elbow down. You're really restricted on moving your arm or your shoulder. The sling really helps. It keeps you restricted so that you don't go and reach and lunge for something. Slept in a lazy boy chair, you need to move more upright because laying on your back forces your shoulders to fall back too far. Though I have to admit, as comfortable as lazy boy is, after 8 nights, 9 nights in there, yeah, that's enough.
A week after surgery, Paul returns to Romeo Orthopedics for his first follow-up appointment.
So how's everything been going since we saw you last?
Good.
Yeah?
Yeah, I mean, range of motion is good.
When Paul came back for his first postoperative visit, we reviewed everything with him. He had an excellent understanding of our plan and was able to demonstrate exactly what he was doing with his shoulder, how he was able to use his arm in the correct way without putting any stress on the incision or the tendon. Just let me see what you can do as far as like bending your elbow up and down like this. You bend it up and down.
Paul has the sutures removed from his incision and gets x-rays to assess the healing process. He's then given the green light to proceed with his recovery as planned.
Overall, everything looked good when we went through the appointment on the way the scarring looked, the way the sutures had come out, and then just a little bit of the motion that was on the shoulder. So.
For the next 4 weeks, Paul continues light rehabilitation exercises, both at home and with a physical therapist.
There are certain exercises that in essence need somebody else to help you with. And the whole idea there is to have some motion within your arm, but you're not yet allowed to actively push it. And that's even in all the therapy for the first few weeks.
After 6 weeks of wearing a sling and keeping up with a program of protection and exercise, Paul is ready to visit Dr. Romeo once again to assess his progress.
Already at 6 weeks, Paul has more motion in his shoulder than he did before surgery. And at this point, we're able to test his shoulder and we're able to confirm, in fact, the tendon has healed nicely down to the bone, so he does not need to wear his sling or immobilizer anymore. And we can get him started on using his arm for everyday life, as well as progressing with his physical therapy program. We've seen the difference already in Paul. He's appreciated that, and that motivates him even more to try to get the very best result possible.
Will Paul have the motivation to stick with his rehab program? On the next Advancements in Healthcare, we'll see how Paul takes on the final stage of his shoulder replacement surgery.
Hi, I'm Dr. Anthony Romeo. If you have a shoulder problem that's similar to Paul's, then give us a call or contact us online. We would love to come up with a treatment plan that would get you back to the things that you love to do.